is the Florida Hospital Nicholson Center, and I am Scott Magnuson, Director of the second annual International Obstructive Sleep Apnea Surgical Dissection course. The purpose of this course is to design a curriculum that is comprehensive in nature. The surgeons are going to learn different procedures that they can perform on the palate, tongue-based surgery, jaw surgery, even hyoid and laryngeal surgery on patients who suffer from obstructive sleep apnea.
This conference in Florida is offering to the participants, as I think, a very unique composition of intense lectures with good discussion, and in the afternoon the lab dissection, where the participants can go through all the different possibilities of surgery.
This course allows you to acquire new procedures that can create anatomical changes that do not occur with traditional surgery.
There's a variety of techniques to treat any particular part of the upper airway, which is the focus of this course. And getting the breadth of experience from different experts just adds to the richness of the course.
There's faculty from Egypt, Germany, the Netherlands, Australia, both sides of East Coast, West Coast of the US.
We had 12 members of the faculties from all over the world, 32 attendees from all over the world, and it was amazing and very interesting to share our knowledge.
Each surgeon has a unique perspective and approach to patients with obstructive sleep apnea. These surgeons give their expertise and teach their expertise to the individual surgeons who are participating, where then they can go home and bring this to their own practice.
This is a marvellous opportunity to learn the latest techniques in sleep apnea surgery, which are constantly changing.
So I think this is one of the most distinguished and most arranged courses I have met in my career.
This is a state-of-the-art facility, so the cadaver lab is really phenomenal.
The facility, the Nicholson Center, is awesome. I mean, it's the standard for all other facilities in the world that I've seen. And it certainly has great optics and video that are really far and above other places.
The cadaver specimens they have are fresh frozen cadavers. The tissues are beautiful to operate on. It's very easy to define the muscles and perform the operations in a very realistic fashion.
And what that really allows then is the participants to really learn these reconstructive procedures, because that's what we're changing from is destructive procedures to reconstructive procedures to make the airway function better, and do that in the most minimally invasive way that we can do it.
One of the things that we find in doing these courses is that we also learn as faculty and modify our techniques. Over time, I think this helps refine the techniques that we end up teaching at these courses.
The surgeries that we perform here are really state-of-the-art, so whenever you would consider to do a course, I would say take this course, because it's by far the best that I'm involved in.
At the completion of 3 days, they're going to have a fund of knowledge that expands their scope of practice and the ability to treat patients with a really difficult disease.